This is the Global Neonatal podcast at the Tiny Feet Big Steps conference, and I'm with some beautiful friends dressed better than me again. Haha. So, firstly, I'll get their names, guys. Could you please tell our viewers a bit about yourself and, yeah, where you're coming from as you come today for this conference?
Sure. Hi, my name is Michelle Yates. I'm an American family medicine physician and I work and live in Ethiopia.
Hello, my name is Bizunesh from Ethiopia, from Neonatal ICU, and I'm glad being here. And I was happy. I learned a lot. This is all.
Hi, I'm Habeneyom, a pediatrician working in Sodo Christian Hospital in Ethiopia. This is my first time to attend Tiny Feet Big Steps Neonatal Conference in Tanzania.
Great. So, yeah, as you can see, they're looking really beautiful. Today we're having a banquet and everyone's prepping and about to enjoy a feast. And I thought to grab them just to have a quick conversation and just like talk about Ethiopians at this conference. So, guys, us being midway through the conference, what are your thoughts? How have you been feeling? Buze, start with you.
I was very happy. Everything makes me happy. I would like to come again and go back and share what I have learned to my friends and my staffs, and even for my family.
And it's your third time here?
No, the first time. First time here.
Okay.
Okay, so about the conference, not only international conference, in my country, even I didn't participate in neonatal conference even. So this conference teach this a lot. I will participate a lot of conference then after. So in this conference, I expect not this much. I will get a lot of knowledge about to care neonates, sick newborns, especially in low and middle income countries. So in my country, there are a lot of health setups who cannot buy expensive materials to help little babies. So in this conference, I get a lot of skills to use local materials to help little infants or newborns. So the most important thing is my community believes that if the baby is born a little, less than 1,000, for example, so they believe, oh, this didn't survive. We'll not waste time and money. We'll feed and take care of our older children. We should go to our home. So I learned that in this conference, I should change my community's mind that little babies can grow and become old and can be a president.
Amen to that. And Cheryl?
Yeah. This is my third year at the Tiny Feet Big Steps conference. And each year I come back, I've brought different members of my department each year, but more than the knowledge that we've gained and the really lovely situation that we're in, the conference facilities are nice. It's really the community that we have and knowing that we're in this struggle together. And each one of us face these challenges every day in terms of life and death and how to manage with limited resources and even things like lack of blood and lack of material, lack of drugs. And so together we can share and we can process and we can learn and we can encourage one another. And so really, it's not just about knowledge sharing. It's about feeling that we are in it together as a united force to really tackle this big problem of taking care of tiny babies.
Thank you so much, guys, for just sharing your reflections and just what this conference means to each of you. The last thing before we dash to the banquet is, what are your hopes and expectations as we draw closer to the end of the conference? And yeah, any other thoughts you'd like to share? I'll start with Buze.
End of the conference.
Yeah, your hopes and expectations as the conference continues.
Maybe I will be expert nurse in a NICU and work harder than what I have. And I want to say thanks for Salsa Group and who invited me to this conference. Thank you very much.
Okay, so the rest of the conference so the conference started 3 days back, so today is 3 days. So we have learned a lot of basic cares to tiny feet, big steps, little babies. So the rest of this conference, it will continue for 6 days, 3 days. So I may expect to the next conference, these little babies grow and they may expect an interview or their family may share their information.
And I think the rest of the conference looks wonderful. The conference schedule on the last day has a lot of really practical aspects of what are the next steps. And so I think that coming as a team, having their 2 physicians and then 1 nurse, that will allow for us to really evaluate quality improvement projects and implementation so that we can take what we've learned in a really practical way and then bring it to the space that we work and share it with the community around us and then the surrounding hospitals that we neighbor with.
Great. An inspiring group of people on a beautiful evening in Arusha, Tanzania. And now we're off to dance. All right. Thank you so much. Let's go, guys.